So I have a question for you this morning. I think we know that there's been greater concerns lately on this healthcare cost and the rising cost of living. And of course, we have the 3 M's like Many Shield, Many Save, Many Funds. It is good to know that we have all this. And for the large hospital bills, I think generally for the subsidies, we are able to manage that. However, we'd like the Minister to share with us what else are we actually doing for the elderly and the sandwich class. Thank you.
Thank you. It's a very valid question, and in fact, it's an issue that the Ministry of Health has been concerned about. Okay, Auntie, 我知道了，等一下我们叫你，可以坐下先。So I think we are very mindful of the impact of the healthcare costs, especially for the long-term care, intermediate and long-term care, and also for the middle income. Because hospital bills are by and large taken care of by 3M, and we have other schemes to help those who are needy. But for the intermediate and long-term care, even if the bills are small every month or every visit, but over the long term, it could accumulate to a significant sum of cost for the residents, for Singaporeans. And therefore, the government has been studying this problem, this challenge of intermediate and long-term care cost. So recently, during the last budget debate, the last Committee of Supplies debate earlier this year, MOH has announced the enhancement to the subsidy for the intermediate and long-term care. We have increased the amount of subsidy for them, community hospitals, nursing homes, as well as other services for the intermediate and long-term care to keep it more affordable. At the same time, we have also expanded the scope of the coverage to include up to middle income, because we realize that even for the middle income, over the long term, the burden of long-term care can be a concern to them. So we have expanded the subsidy to include up to middle income. And we will continue to explore how we can help them further to better afford the intermediate and long-term care. But healthcare cost is an issue that is not easy to address overall. I'm not talking about overall healthcare cost. Because over time, you'll find that with new technology emerging, the cost of treatment will be more expensive than the old technology. And particularly as we get older, we may find that we tend to see doctors more often. And when we feel ill, it may take longer for us to recover because we are getting older. So our recovery rate will slow down. So it will, to individual, you'll find that the cost of healthcare may go up simply because we are getting older. We see doctors more often, and we go to hospital more often, and it takes longer to recover from the hospital. So the best way to address all these healthcare cost challenge is for each and every one of us to stay healthy. If we exercise regularly, eat sensibly, and adopt an active lifestyle, then all of us can stay healthy longer. And that will not only reduce the healthcare cost of each individual, but will also help to reduce the healthcare cost burden of the whole nation. But from the government's point of view, we are adopting a number of approaches. First, we look at how we can ensure that our system is efficient, minimize wastage, minimize inefficiency to make sure that our healthcare system is cost effective. So we regularly innovate, find new ways of delivering healthcare services so that we can make use of the available capacity, make use of the available system to deliver healthcare in a very cost-effective way. Recently, we announced the changes to the primary care system to tap on the private GP capacity to help us look after the subsidized patient. This will help to reduce the overall healthcare cost. Secondly, we also look at how we can cite the patients more appropriately. What it means is that if the patients do not need to be looked after at the hospital, which is very costly and expensive, they can be looked after in a community hospital, or they can be looked after in a nursing home, which is lower cost. Or better still, if they can be looked after at home by their family members, and we provide as much support as we can so that we keep the patients out of the expensive healthcare settings. So this way we also keep costs low. Even on the primary care side, we also have to continue to ensure that we do not send our patients for unnecessary scanning or testing and so on, which are costly. So we will have to have a very strong governance protocol to ensure that patients are sent for the necessary scanning, but not the unnecessary ones. And we also want to make sure that they are also not given unnecessary treatment. So we want to make sure that by doing so, we keep the healthcare costs low. By the end of the day, the most effective way is to stay healthy. That's why this morning I'm very happy to see many of the residents involved in all kinds of healthcare activities, whether they are qigong, whether they are playing the tai chi ball and so on. So these will all keep ourselves healthier, not only healthier, but also happier. So let us try to live longer at the same time, live healthier. And because if we are able to live longer and live healthier, then we will be able to live more happily. So thank you very much.